And the last part of our actions as a climate committee is to bring more learning about these issues. And without further ado, that gives me great pleasure to introduce Professor Edward Maibach, who's the director of the George Mason University Center for Climate Communications, to tell us about climate change. Edward, if you're online, take it away.
Yes, thank you so much for inviting me to share my thoughts with you today. And to my Swedish friends in the room, I say hey. To my all other friends in the room, I say aloha. And let me just actually build on saying that I actually would love to be with you today. I've spent many a wonderful time in Uppsala, and June 17th seems like just about the perfect time to be there, and I've checked the weather. It looks like you're having the perfect weather. So after the meeting today, I hope you get out and enjoy a lovely evening. But I chose not to be there because for exactly the reasons that Stephen just suggested, I actually have dramatically curtailed my air travel, both professional and personal, for reasons related to my own carbon footprint. And that and many other ways that I have addressed my carbon footprint, not because I believe my own individual actions as a consumer make all that much difference. I am one of 8 billion people on the planet, as are each of you, but because it allows, knowing that I've done all that I can do to reduce my own carbon footprint, allows me to be as courageous and as forward-leaning as possible in all of my professional work to bring about smart climate and health policies that I absolutely know will make a difference. I actually started my career about 41 years ago this week at the U.S. National Institutes of Health, working on high blood pressure control. So my work from the beginning focused on behavioral nutrition and physical activity promotion. I have cycled through that kind of work off and on over the past 4 decades, and I am doing it once again, but I'm doing it from a very different perspective this time, and that's the perspective I want to share with you today. So that the title of my talk is Protecting Human and Planetary Health, New and Unique Roles for Health Professionals. And let me start by sharing my slides. It didn't work. All right. Can somebody give me a sign that you're seeing my slides? All right, I'm just going to assume that you are. So let me start by asking you a question that you all know the answer to, but I think it's a really important question. And the question is, what are the leading preventable causes of death worldwide? Fortunately, I can't hear any of your answers, but I know that you've got it in your head, and I know you have largely the right answer. So allow me to share the most recent answer that I was able to find in preparation for this talk. And the leading preventable cause of death is from high blood pressure. The second leading preventable cause of death is from smoking, tobacco use. And the third leading preventable cause of death is from air pollution. But I want you to actually look down on that slide after the number 3 spot and go down to the number 6 spot, and you'll see outdoor air pollution in addition to the air pollution category overall. So if you add those two numbers, you get roughly 11 million causes of premature death a year, which if you can do your math or at least compare numbers, you can see that actually there's a very important case to be made that air pollution is the number 1 leading preventable cause of death worldwide. In my 40-some years in the field, I have long seen tobacco as public health enemy number 1, as the leading preventable cause of death. Although even though I started my career working on high blood pressure control, nevertheless, tobacco has, at least in my mind, and I think probably in many of our minds, been seen as really the leading preventable cause of death. But when you really think about the numbers that I just presented to you, and look at other numbers that I've drawn for this slide, as I said before, it's really pretty easy to make the case that tobacco use, while as serious a cause of morbidity and mortality as it is actually not the leading cause, but in fact, fossil fuel use is. Burning fossil fuel, which creates air pollution, and which the extraction, processing, and combustion of fossil fuels actually creates even more premature death than what is indicated on this slide. But if you just look at this on an apples to apples comparison, it's pretty easy to make the case that fossil fuels are a bigger cause of morbidity and mortality worldwide than is tobacco. Like tobacco, specifically in the form of secondhand smoke, burning fossil fuels has profound health harms across the lifespan. And some of these causes across the lifespan are actually begin before birth, again, like tobacco use. So the 8.7 million premature deaths per year, that's simply the mortality count. But the morbidity count, which is really still now just becoming increasingly clear as to what that count really is and how to tally that count in a fair way, it begins before birth, because pregnant women who are exposed to air pollution are more likely to give birth to low birth weight children, like women who smoke. They are more likely to have children who are stillbirth. They are more likely to have preterm delivery. And the children who are born to women, to the degree to which women are exposed to air pollution in utero, their children are more likely to have neurodevelopmental disorders like ADHD, like reduced in IQ, and autism. And among children who are exposed to air pollution throughout their childhood, and that's most every child on the planet, but in some countries, in some communities, much more so than others, those children are much likely to have asthma, worse asthma attacks, chronic bronchitis. And in their adult years, and many of those impacts of exposure to air pollution will be carried with the child throughout his or her lifetime. As people move into their adult years, exposure to air pollution, as we all know, is directly associated with respiratory problems, including asthma, emphysema, COPD, and chronic bronchitis. Exposure to air pollution is more likely to exacerbate cardiovascular disease, including increased risk of MI and stroke, and as well as cancer, increased risk of breast and lung cancer. And on the other end of the spectrum, the senior portion of the lifespan, people who have been exposed to more air pollution are more likely to suffer neurodegeneration, including Alzheimer's and other forms of dementia, as well as Parkinson's disease. So when you do the full count of morbidity as well as mortality, it's pretty, as I said before, it's really quite easy to make the case that fossil fuels are even a more pernicious threat to the public health and well-being than is tobacco use. And air pollution, exposure to fossil fuel harm through air pollution, is only one of 8 pathways by which climate change harms human health. So in addition to air pollution, climate change is making extreme heat events, heat waves more common and more severe, is making our weather more extreme, more dangerous. It's exacerbating vector-borne illness, waterborne illness, and foodborne illness. It's exacerbating problems of hunger and malnutrition in countries across the world. And perhaps the most talked about, although largely invisible consequence of climate change is on our mental health. People who have suffered from extreme weather events, been dislocated from their homes, perhaps, as a result of extreme weather events, they're very likely to be suffering PTSD to a greater or lesser degree. And all of us, every person on the planet who is aware of the profound threat that climate change represents to human civilization, many of us are suffering from persistent anxiety, and some of us are suffering from climate-related depression. So these are the 8 pathways by which climate change harms health. And fossil fuels is the number one driver of climate change. Which is why I have come now at this point in my career to conclude that our climate and our health have a common enemy. And that enemy, my friends, is fossil fuels, which begins to suggest what we as health professionals, what our new and unique roles are in addressing that common threat. We do have something going for us, which is nice. We've got the Paris Climate Agreement, which was first negotiated in 2015 in Paris. Within the next year or two, every country in the world ratified the Paris Climate Agreement, so all countries are in. Unfortunately, the US dropped out for a short period of time, about 4 years. I need not explain why that was. But we are back in now. Essentially, all countries of the world have agreed to do their part to limit global warming to well below 2 degrees centigrade, ideally closer to 1.5 degrees. And that's incredibly important. That is, in my opinion, the most important public health goal, as well as really the most important public health global treaty that has ever been ratified. Shortly after ratifying the Paris Climate Agreement, where the goal was limiting the warming to less than 2 degrees, the leaders of the world asked the IPCC, that's the Intergovernmental Panel on Climate Change, the world's leading experts on climate science, they asked them to do a more refined analysis. Basically, the analysis that IPCC was asked to do is, okay, what's the difference between limiting warming to 1.5 degrees C and 2 degrees C? Essentially, the range in which was codified in the Paris Climate Agreement. And this was a report released in 2018. And the key finding of that report is that a half a degree of warming beyond 1.5 degrees C, in other words, 2 degrees C, would mean substantially more poverty, extreme heat, sea level rise, habitat and coral reef loss, and drought. All of those have profound public health consequences. I think the most important statement they made is that every 10th of a degree of warming has grave public health consequences. So while you may have heard that the odds of us limiting the warming globally to 1.5 degrees C, the odds of achieving that are long, that does not mean we have lost, because this notion that every 10th of a degree of warming that we prevent is preventing grave public health consequences. So wherever global warming eventually tops out, whether that's 1.5 degrees, 1.7 degrees, 1.9 degrees, or 2.1 degrees, every 10th of a degree that we as a community, as a public health community, manage to shave off the top of that warming will be a profound gift to the future public health and well-being of our children and grandchildren. The current UN Secretary General, Antonio Guterres, he is a man who really knows how to make things clear. In response last year to the IPCC releasing their 6th assessment report, AR6, he said, there is no kind way to put it. We are sleepwalking to climate catastrophe. The 1.5 degrees C goal is on life support. It's in intensive care. Notice that he's speaking in medical metaphors, which I particularly like, and he is such a shrewd communicator. I think he has a profound understanding of how powerful health and medical metaphors are. He went on to say that nearly half of humanity is living in the danger zone now. That unchecked carbon pollution, a very good term, carbon pollution, as opposed to greenhouse gas emissions, unchecked carbon pollution is forcing the world's most vulnerable people on a frog march to destruction now. And he concluded by saying, delay equals death. A very powerful set of 3 words. I spent a portion of my career working on the HIV epidemic, and the notion that silence equals death proved to be a catalyzing phrase here in the United States with regard to creating alliance between people who were dying from AIDS, people who were at risk of being infected with AIDS, and the very public health and medical community who was trying to meet their needs. So this notion that delay in our response to climate change equals death is one that I want you to all to keep first and foremost in your minds. Now I want to take this to another idea that has shaped all of our work over the past 2 decades. When I started my work in 1982 in public health, we were very excited about the behavioral causes of the opportunities to improve public health and well-being through behavior change, the behavioral determinants of health. But over the next couple of decades, we realized, well, talking about the behavioral determinants of health is perhaps an important part of the equation, but it's only part of the equation. And the more important part of that equation is the social determinants of health, the determinants of health that are illustrated on this slide. And we know now, more than even 20 years ago, how true that really is, because unless we address the social determinants of health, we really have no reasonable expectation that people will have the wherewithal to embrace the behavioral determinants of health. In a paper that Courtney Howard and myself and about 40 other authors published earlier this year in Lancet Planetary Health, we made the argument that the ecological determinants of health are even more fundamental than the social determinants of health. Because when we disrupt the ecological determinants of health, perhaps especially our stable climate, we also disrupt all of the social determinants of health. We disrupt our healthcare systems at precisely the moment when we most need them. For example, during extreme weather events, when people's health is being harmed, and ultimately we're eroding our temporarily at least disabling the capability of our healthcare system to address the health needs of those people. And the ecological determinants of health also have direct impacts on human health and well-being in those 8 pathways that I mentioned a moment ago. So since 2019, some colleagues and I have been trying to crystallize our own thinking about what can health professionals do to help limit global warming to 1.5 degrees C. And as my thinking on this continues to evolve, but back in 2019, when we first published this paper in PLOS Medicine, we concluded that we do have a necessary role, and I'll tell you about that role in a moment. I've already started to tell you about that role, but we also have a unique role. And the unique role has been what I've been focusing my research on, trying to understand that unique role and how we can best live up to it. So why is this a necessary role for us to play? Well, it's a necessary role because climate change and the continued use of fossil fuels are humanity's greatest threats to public health. This is our lane. Anybody who tells us that this isn't our lane, they aren't paying attention or they're being incredibly disingenuous. We do have some colleagues in the health community who haven't yet concluded that this is our lane. But in my research, I've polled public health professionals, nurses, physicians, extensively in the US, as well as in about a dozen countries around the world. And I'm happy to tell you that most of our colleagues worldwide do understand this to be our lane. They admit that they don't know a lot about the human health consequences of climate change, but in response to my survey questions, they have clearly indicated that they understand it as a profound threat to human health. And more importantly, they understand and want to see their own professional societies and their own profession lean in to start to address this challenge. So I'm happy to say that even though people in the fossil fuel industry will tell us this isn't our lane and we need to stay in our lane, we, members of the health community, we understand this is our lane. But the more interesting part of the equation for me is this question: what's our unique role? And I've spent a lot of time over the past 5 or 10 years trying to unpack that question. What is our unique role? This summer, actually last week, the Annual Review of Earth and Planetary Sciences published a paper by myself and some of my colleagues in which we made the case that simple, clear messages repeated often by a variety of trusted and caring voices. This is the evidence-based guidance for all effective public health communication campaigns. It's also, in my view, the evidence-based guidance for any form of effective public communication campaigns, including climate communication campaigns. So in this particular annual reviews chapter, my colleagues and I are trying to coach our colleagues in the climate sciences how to develop simple, clear messages, how to think about getting those messages repeated often, and how to tap into a variety of trusted and caring voices as the carriers of those messages. Most people in the world don't know climate scientists. They don't necessarily trust climate scientists, but you and I, my friends, they trust us. And I'll come back and I'll make that point in a moment. But first, another audience participation exercise that I won't hear what's on your mind because you can't tell me, unfortunately, but I do want you to get a clear thought in your mind. What's the first thing that comes to your mind when you hear the words global warming? We have asked this question to more than 40,000 people in nationally representative surveys in the US over the past 13, 14 years now. And the first thing, it probably almost certainly differs depending on where you are in the world, what the first thing that comes to people's minds are. Although my colleague Tony Leiserowitz at Yale, who has done global surveys in 120 countries, in many of those countries, people haven't heard of global warming or climate change. So for them, the first thing that comes to mind is nothing, a big question mark. For those of us who do know what global warming is, who have heard of it, among Americans, the first thing that comes to mind is plants, penguins, and polar bears, particularly polar bears. This is the iconic image that Americans have seen. I would guess the same is true for Canadians and Australians and people in the UK and in much of the EU, maybe less so in other non-Western countries, but this is what comes to mind first for Westerners. What comes to mind second, the second most common response to our questions, and these are open-ended questions that we put to people and we code their data, they are responses that relate to science, sort of abstract notions about science, like the Keeling curve, which some people actually can identify by name. The third most common response is politicians. And when we look at their other answers, we realize the politicians they are naming are politicians they don't respect. Politicians who they feel represent a point of view that is very different than their own, who have values that are not consistent with their own. So when we've learned that politics or politicians are the third most common top of mind association, sort of like polar bears, which some people care deeply about, but most people think about as a distant thing, and science, which is highly abstract, not at all concrete, not personally engaging. When people tell us they think about politicians of the other party, we know we're not in a good place. More and more over the past dozen years or so, we've seen references to extreme or dangerous weather. That's a step in the right direction. That really does represent progress because people understand extreme weather as dangerous weather. But not once in those 40,000 people who've responded to my question have we ever heard an answer that talked about health, our health, the health of our children, the health of our other loved ones. And our research shows that this is the top of mind association that is most engaging, that is most likely to actually make people care about the issue and get people to roll up their sleeves and become involved in bringing about or supporting collective action to bring about climate solutions. So the very thing that you and I spend our lives working on is the very thing that is missing from the mental model of at least most Westerners when they think about global warming. So this begins to suggest what our unique opportunity is, because we can talk about the human health relevance of climate change. Americans may be uniquely dim when it comes to the issue of climate change, not because we are dim as a people, but because we have been the target of climate misinformation campaigns for many, many decades. But despite those misinformation campaigns, even when we started this polling project in the fall of 2008, it was true that most Americans understood that climate change is happening. Certainly most people in the EU understand. Most people in the world who know what climate change is understand that climate change is happening. But most, until quite recently, people tended to see it as a distant threat. Distant in time, so 2100, sure, but 2023, maybe not so much. Distant in space, happening in parts of the world that some people can't find on a map. They have heard about it, but don't really know where it is, don't have any personal connection. And again, it's an abstraction. And ultimately, as I've already said, distant in species. We think about polar bears, we don't think about people. This is data from our polling project in the US. We call it Climate Change in the American Mind. This was from a survey we conducted last spring. And we asked people, how much do you trust or distrust the following as a source of information about global warming? And what, this is arrayed by all registered voters on the left-hand side of the slide, moving across the political continuum to conservative Republicans on the right-hand side of the slide. In the US, perhaps more than anywhere else in the world, our climate change problem is frankly a political problem. We have a party who has aligned itself with the fossil fuel industry to deny the reality and or the seriousness of climate change and to undermine the types of climate solutions that would help us keep the warming to 1.5 degrees C. So in the United States, it's particularly important that we find ways to bring our conservative brothers and sisters along and try to break the spell that they are under as a result of the disinformation campaign that has been perpetrated on them and their elected officials through Fox News, through their conservative media sources and other channels over many, many years. And when you look at the red bars, what I've drawn, highlighted people's trust in their primary care doctor, and their which is concrete to them. People know their doctor. That person has a name and a face and is trusted. I've also highlighted in the blue rectangles their trust in the American Medical Association, which we use simply as a proxy for medical voices in general, health voices in general, one that Americans would know what it is. And you can see that among all registered voters, their primary care doctor, they're right up there, highly trusted, almost as much so as NASA, as friends and family, and climate scientists. So that really begins to suggest a unique role that we have, but the uniqueness of our role can be best understood if you look at the other column on the other side of the slide, our ability to engage both liberal, I'm moderate, and we don't really have liberal Republicans in America anymore, but we do still have moderate Republicans, and we have many conservative Republicans. Their primary care doctor is the second most trusted person. It is the person they trust second to most, after only their friends and family, the people they know the best, in terms of a source of information about global warming. To me, this suggests a really important part of our unique opportunity. We, perhaps uniquely, can educate conservatives who, as I've said before, have long been the target of a climate misinformation campaign. They're willing to listen to what we have to say. Over many years, we've taken our survey data and many other forms of data collection. We've analyzed that data to identify the predictors of people who are most concerned about climate change, people who are most engaged in bringing about climate solutions, and people who are most fervent in their support for collective action. Collective action specifically meaning smart public policies to deal with global warming. And it really comes down to what I call 6 key beliefs, or since they're all true, 6 key facts about global warming, which can be expressed in only 12 words. So this notion that I like to talk about of simple, clear messages taking the complicated issues that we work with and rendering them simple and clear so that people can understand them and reach appropriate conclusions, it really comes down to only 6 key facts: that global warming is real, that it's human caused, that virtually all of the climate scientists in the world are convinced, based on evidence, that human activity is warming the planet and it's causing harm, that it's bad in the case of what we can talk about, that it's bad for human health and well-being. There are serious health impacts already, and they're going to get much worse if we don't do what is necessary to limit warming to 1.5 degrees. That there's hope, that the actions we can take will make a big difference. And I'm going to talk a lot more about that in a moment, because that is another really important part of our unique role. We can talk about the benefits that will accrue immediately upon taking action, as opposed to climate scientists who tend to talk about the benefits that will accrue many decades in the future. The health benefits of climate action begin to accrue almost immediately. And then finally, and this is actually a relatively recent addition to, we used to say 5 key facts, but now we say 6 key facts, because our research shows over and over again that the majority of people in the world are worried about climate change. They care, but they think they're in a small minority. And the more they realize they're actually part of the majority, the more they are likely to get involved and take actions that will make a difference. So it's real, it's us, experts agree, it's bad, there's hope, and others care. You are in a majority. So let's get busy in dealing with this problem. Coming back to this notion of the 8 pathways that by which climate change is harming human health: air pollution, extreme heat, extreme weather, vector, water, and foodborne illnesses, hunger and malnutrition, and mental health harms. My colleagues and I have written 8 short essays explaining each of those 8 pathways. The essays, I call them essays, they're really only about 150 words, but we talk about what's in each of those 150 word essays. We talk about what's happening in terms of our changing climate, how is that harming our health, and whose health is most likely to be harmed. And across all of those 8 pathways, it tends to be the not yet born, babies in utero, children, pregnant women, seniors, people with chronic illnesses, people in low income and communities of color, and people who earn their livelihoods outdoors and therefore spend more time outdoors. These are the people who are being hurt first and worst. And our research has shown that when we give people this information, 1,200 words in total, give or take, it increases their cognitive engagement in the issue as well as their affective engagement in the issue. It makes them, by that I mean, it makes them see the personal relevance more clearly than they did before, and it makes them more worried about climate change than they were before. And this is especially true with people in the middle and on the sort of the middle right side of the political continuum. So that survey data that I showed you a moment ago, which suggested that we have an especially unique opportunity to reach people to reach beyond simply the members of the liberal community who are already quite concerned. And this was our first study published in 2018, which began to confirm that what looked like a unique opportunity is in fact an opportunity. And this is where it comes down to the work that you all do, the behavioral nutrition, the physical activity promotion, because there are 5 policy solution pathways that the more progress we make down these pathways, the more we will improve human health and well-being, as well as planetary health and well-being, because the actions that we can take in each of these pathways are good for our climate and good for our health. And those pathways, number 1, the use of clean, renewable energy and reducing energy waste. The benefits of that get profoundly to helping to clean up our air and our water quite quickly, which quite quickly yield improved health outcomes. Number 2, the nutrition domain. Anything that we can do to favor climate-smart foods, farms, and food systems is good for human health. As you all know all too well, it's good for planetary health. Number 3, the physical activity element. The more we can support, the more we can do to advance clean and active transportation options, as many of you have been doing for many decades, the more quickly we will benefit human health as well as planetary health. And numbers 4 and 5, the more we can do to improve our buildings, including our homes, and improve our community environments so that they, for example, so that they allow for safe, active transportation. Again, the more we are benefiting human health as well as planetary health. When my climate science colleagues talk about these benefits, they tend to talk about the benefits that accrue over climatic timescales, decades, centuries, which is okay, it's real, it's true, but people, our behavioral economic colleagues, they tell us that we don't like to make investments today for things that will pay us dividends many decades, many years or decades in the future. So talking about the climatic benefits has certain inherent limitations. But when we talk about the health benefits of these policy solution pathways, we can, with a straight face, because it's absolutely true, we can talk about how the health benefits accrue almost immediately, and they accrue primarily locally in the communities that take the actions, which again is an important insight from behavioral economics. Most people, most politicians in particular, don't like to invest public resources from their community in global solutions. They like to invest in local solutions because those are the taxpayers whose money they are spending. So talking as a health professional about these 5 policy pathway solutions that address planetary health as well as human health, they are a profound and unique opportunity that perhaps we alone can take advantage of. On the bottom right of this slide is a report that my colleagues in the Medical Society Consortium on Climate and Health have produced to really go into detail to help people such as yourself, such as me and yourselves, how we can make these arguments, how we can use simple, clear messages to explain, use our trusted voices to explain the importance of these 5 policy pathways. Our research published 2 years ago now showed that the optimal climate and health narrative has 3 components. The first component is we do have to talk about the health impacts. We have to help people understand that climate change is bad for human health because most people don't know that. And our research has shown when we tell them, it makes a difference. The second thing we need to do is we have to talk about policy solutions, not individual behavior change solutions. I don't want to push that point too hard, but research suggests that when you talk about individual actions that people can take, if they are personal lifestyle actions, it tends to make people feel that that's not going to make a difference. But when we talk about policy solutions, collective action solutions, it makes people feel powerful. They see that through smart public policy, we can really make a difference, which begins to show to them the actions that they can take that will make a biggest difference in terms of enhancing the likelihood of our politicians implementing smart public policies. And then the third element of the effective climate and health narrative is simply to affirm helpful social norms, to that others care point that I mentioned a moment ago. You have to acknowledge that, look, you are one of many, many people, the majority of people in your community and in your nation who care about climate change. And lots of us are already starting to take action. Maybe you acknowledge that we need more of us to take action in order to get the smart public policies that will really make a difference. But by acknowledging the helpful social norm, we know it makes people more likely to take political action, which is the dependent measure in our research. All 3 of these these 3 components of the narrative, all of them have an impact. The impact is additive. So each of these 3 things makes people more likely to take political action. Of these 3, solutions is the biggest effect size comes from entering policy-based solutions into our narratives. And as I sort of indicated before, This is equally, in this case, this is equally true for liberals, for conservatives as for liberals. Again, suggesting this is the climate and health narrative is a unique opportunity for us to engage the very citizens who most need engaging. Most recently, and not yet published, we tested a fourth component to the climate and health narrative. And that fourth component is calling out the opponents to climate action. Since these things are such that the smart public policy offers so many benefits, it raises in the question, it should raise the question in people's minds. So if it's so good, why haven't we done this yet? And the reason why we haven't done this yet is because we have very powerful opponents. Those opponents are the CEOs of fossil fuel companies and their lobbyists. And those opponents are the politicians who are in the back pockets of fossil fuel CEOs and their lobbyists. And so we've tested that optimal climate and health narrative, both with and without specifically calling out these categories of people: fossil fuel CEOs and their lobbyists and the politicians in their back pockets. The bottom line is it strengthens our narrative. It makes people more likely to contact their elected officials to advocate for advancing climate and health solutions. And this, quite curiously, adding this into the equation, into the narrative, is particularly effective with Republicans and independents, the very people who have been the target of misinformation campaign by the fossil fuel industry. So calling into question the trustworthiness of the leaders of the fossil fuel industry is most effective with conservatives, which is incredibly good news as far as I'm concerned. So to summarize, this is why we have a unique role, because the climate and health narrative, it makes the problem personal. And when we understand the problem is relevant to us, we are more likely to take action, because it brings the benefits of solutions into the present and into our communities, again, heightening the likelihood of us working with our neighbors, with our fellow citizens of our community, to try to bring into effect smarter climate and health policies. And ultimately, because it helps to depolarize the issue, it brings conservatives and liberals closer together so that we can agree that we have a problem, and so that we can have an adult conversation about what are the best options for dealing with our problem. Very briefly, out of my center at George Mason University, over the past 7 years, we've organized what we call the Medical Society Consortium on Climate and Health. As of yesterday, I learned we have 50 medical societies who are our members. We have helped incubate 25 state affiliate groups. For example, here in Virginia, we've got a group called the Virginia Clinicians for Climate Action. Our Medical Society Consortium, we're working to influence and bring about smart federal level climate and health policies. Our state affiliates are working to create smart climate and health policies in their state and to some degree in their communities. So this has really become an amazing collaboration between many different groups. And our theory of change is incredibly simple. It really comes back to that notion of simple, clear messages repeated often by a variety of trusted, caring voices. We are doing the messaging research to help the members of these medical societies and the state affiliate groups use their trusted voice to educate their neighbors, to educate their local policymakers, their state or provincial policymakers, and their federal or national representatives. This is a narrative that can absolutely prove to be the difference in getting smart public policies enacted. I wish I had more current data for you, but this is data from essentially sort of one indicator of the question of, are we making a difference? By developing and using the trusted voices of health professionals, are we making a difference in helping members of communities in America understand the human health relevance? This data started, the gold bars are from October 2024, before we started the consortium. The green bars are from April 2020. 3 years old now, but it's the most current I've got. But as you can see, across each of these conditions, each of these ways in which climate change is in fact harming people's health, there's been a fairly dramatic awakening of Americans about about understanding that these things are becoming more common in their community. So on the top end of the slide, people, in 2014, about 1 out of 3 people understood that heat stroke is becoming more common in their community as a result of global warming, and now it's more like 6 in 10 people. On the bottom end, it was 1 in 4 people thought that depression was becoming more likely as a result of global warming. It's now up to 4 in 10. So this is one indicator that gives me great heart that we are beginning to make a difference. Allow me to close with the story that I remind myself of every morning when I get up, because although this is a very old story now, and it's a story, it's been pointed out to me that this is a story about mostly dead old white guys. Eric Shivian from Harvard is the only remaining person on this slide who is still alive. He's still working at Harvard, but it's such a powerful story because it cuts right to the heart of what our opportunity is here. In 1980, 7 American and Soviet physicians established a group that they called the International Physicians for the Prevention of Nuclear War. They had a simple, clear message that a nuclear war would destroy civilization and might extinguish human life. Within 5 years, they won the Nobel Peace Prize for their work. And the Nobel Committee specifically said they won the prize for their central role in helping to open arms-controlled discussions between the US and the USSR. Winning the Nobel Peace Prize is a hell of a contribution, but I would contend that that's what's more important is what the members of the target audience, members of IPPNW's target audience said about the impact of their campaigning. That target audience was 2 people, my friend. It was Mikhail Gorbachev and it was Ronald Reagan. And Gorbachev, in his autobiography called Perestroika, published in 1987, he said specifically of them, their work commands great respect, for what they say and what they do is prompted by accurate knowledge and a passionate desire to warn humanity about the danger looming over it. In light of their arguments and the strictly scientific data they possess, there seems to be no room left for politicking, and no serious politician has the right to disregard their conclusions. 5 years later, Mr. Gorbachev sent a thank you letter to IPPNW. What a gentleman he was. And in that thank you letter, he said, I want to thank you for your great contribution to preventing nuclear war. Without it and other effective anti-nuclear initiatives, this test ban treaty would probably have been impossible. My conclusion is that these 7 physicians and all of the other health professionals who joined IPPNW after they created it, they were the ones who made the impossible possible. In fact, not only possible, they helped get the job done. And that, my friends, is the opportunity that we have. So I'm going to conclude by inviting you to join your trusted voice with mine and help me make fossil fuels history. The QR code on the left will take you to we'll send you a text which will allow you to give me your name and email address, and you will become essentially an a perpetually free member of the U.S. Medical Society Consortium on Climate and Health. We will never ask you for money, but instead what we will do for you is we will send you action alerts when there are actions that you can take to advocate for smart climate and health policies. If you are not from the U.S., I ask you to point your camera towards the QR code on the right. That will take you to join the Global Climate and Health Alliance. And by the way, if you're really motivated, you can join both groups. Full disclosure, as I've already said, the Medical Society Consortium on Climate and Health is a program of my center at George Mason. I represent the Medical Society Consortium on the board of directors of the Global Climate and Health Alliance. So the disclosure is I am being self-interested in inviting you to join your voice with mine, but I hope you are convinced based on the information I shared with you that this is our lane, that this is a necessary role for us, and that we together have a unique opportunity. So with that, I don't know if you're able to ask me questions, or I know you're able to ask me questions. I don't know if I'll be able to hear your questions, but I turn the floor back to our moderator, and I'm very eager to get feedback from you.
Ed, can you hear me?
I can, thank you.
Ed, on behalf of ISBNPA, I want to thank you for this wonderful talk. And we're going to give the opportunity to our audience to ask a few questions. Colleagues, we have microphones on the side. If you want to ask Ed any questions, please feel free. Just do a bit of physical activity and walk to the microphones that are on either side of the aisle by the stage. So while we are waiting for them to walk all the way to the microphone, and as part of the different professions that people might trust with the message that you showed us, the health professionals are quite high, were there a question about sports coaches or any kind of sports representative?
Such a good question. We don't ask that in our survey research. I am not aware. I normally would show a slide of data collected by Ipsos, a global polling firm. They ask the trust in various messengers, not in terms of climate change, but they just ask a trust overall. The Ipsos people may well ask about trust in professional athletes, but I haven't seen that data, but it would be a natural thing to ask about.
Okay, we might be in touch with you as a society to try to find out whether that could be a pathway for us.
Fantastic.
Have we got any questions for Ed? Jim?
Hello, Ed. This is Jim Salas, and from San Diego. So good to have you addressing this global audience here. I have had the pleasure of hearing you talk about this a few times, and always inspired, and just makes me want to do more. And let me just, I have a message question for you. And I've been thinking about, how to respond to the continuing disinformation and, failure to take action from fossil fuel companies and politicians. And it strikes me that one reality of this disinformation is that these people are willfully causing problems for our children, our grandchildren. And that seems to me to be something that will resonate with any parent or somebody, anybody who loves children. And I'm just wanting to see what your reactions to this idea are.
Yeah, I think it's incredibly important to those people, the willful actors, who I am absolutely willing to use the D word. They are deniers. They know exactly what they're doing, and they're doing it for financial gain. And the research, the historical research, is really clear on the point that they knew the truth first. The fossil fuel industry was the first major employer of climate scientists. Even in the earliest days of climate science, when individual, PhD level meteorologists were trying to ask the question about, what do we know about the impact of burning fossil fuels on our climate, they were struggling to get research funding from the National Science Foundation and from other government funders around the world. But the fossil fuel industry was hiring them in large numbers. And the historical record shows very clearly that the first generation climate scientists were telling the executives in fossil fuel industries, our business represents a threat to the safety and well-being of the future. Because unless we change our business model, we will be destabilizing the climate of planet Earth. And the facts are very clear that fossil fuel CEOs' response to that was to ignore it and instead to create disinformation campaigns to confuse people and to essentially communicate the exact opposite of those key truths that I talked about. Over the decades, their message has been, it's not real, it's not us. There's a lot of disagreement among the experts. Even if it were real, it's not all that harmful anyway. And oh, by the way, these crazy ideas that certain politicians are trying to force upon us, they're really just a socialist agenda in disguise. They would be terrible, have terrible consequences for our prosperity and the prosperity of future generations. So it helps to acknowledge that conservatives have been the target of a misinformation campaign because, frankly, it gives people an opportunity to realize, okay, I am not a bad person, but I have been targeted by people who are bad people, fossil fuel CEOs and their lobbyists, and the politicians that they have convinced to also believe the lies that they are perpetrating. So the fossil fuel industry, they really wrote the playbook on simple, clear messages repeated often by a variety of trusted and caring voices. They've been doing it for decades. We are way late to the game, but our research suggests that our messaging has the ability to slice through that Gordian knot that they have so nicely created to help people understand why smart climate and health policy is the right thing for us to do. It's good for us, good for our children, good for our community.
Thank you very much. I have a question on the right over there.
Yeah, hi Ed, Colin Greaves here from University of Birmingham in the UK. I'm a behavioural scientist, and I have to say I agree with everything that you have said, apart from one thing, which is you seem to indicate that it was pointless to try and focus on individual level behaviours. Now, I think there is one individual level behaviour in particular that could be worth focusing on, and that is people's voting behaviour. Yeah? So when you get, I don't know if you have in America, we have something called 38 degrees in the UK, and we have other like public campaigning, like they're basically online campaigning groups, and you can sign up to them, you can sign petitions. And so what you could do is set off a petition to say, I pledge to put my vote with the party that has the best climate change policy. And if you can get 20 million, 40 million people to sign that pledge, that's really going to influence the politicians to then change their policies. That's just one idea.
Colin, I agree with you 120%. Whatever I said 20 minutes ago, I clearly said it badly. That is the most important action, is using your voice as a citizen in terms of voting and how you interact with people who are seeking to earn your vote, and making sure that they know that for you, smart climate and health policy is the #1 issue. So what I thought I was trying to say before is by talking to people about reducing their own carbon footprint, there's value to that actually, but it's really important that we make clear that the most important actions people can take are political actions in exactly the way you spoke of, Colin. So thank you for clarifying where I was unclear.
Thank you.
We're going to take one more question on the left.
Hi there, Ed. Shilpa Dogra from Ontario in Canada. I really appreciate your talk today. It's given us so many different things to reflect upon. I really appreciated the slide in particular where you talked about the 5 actions that we can start taking, and certainly there's lots of overlap with regards to active transportation and healthy communities with the scientists in this room. I'm wondering if you can think about ways in which we can catalyze collaborations with the scientists sitting in this room with the climate scientists. Are there any global initiatives to bring these two groups together so that we can start making more of a global impact? Thank you.
Great question. I guess the short answer is I am not sure exactly if there's a global effort for climate scientists and health scientists to work more closely together. Perhaps the organization that I talked about, the Global Climate and Health Alliance, it really is it's a global effort to organize the health community in every country to try to influence the outcomes of the UN COP meetings, the COP negotiations, the Conference of Parties. So, for example, the COP28 is the meeting that will be happening in November in the UAE. And we're very organized. We're working as hard as we can to organize to bring health voices into that conversation, because the climate voices tend not to have a whole lot of leverage over the fossil fuel voices. So I would suggest, while it may not be an active collaboration between climate scientists and health scientists, I think there's this huge opportunity for people in any one of the health sciences, whether that is bringing social and behavioral sciences to the fore or biological and clinical sciences. We all have trusted health voices. So learning how to link arms with peers across states, across nations, and across geographic borders, I think that's where our real strength is going to be found. We have an incredible opportunity to flex our collective muscle, but we have to believe in our collective efficacy. We have to believe that it's not just us individually working as concerned health professionals, but it's us working together to essentially shine a light on the duplicity of the fossil fuel industry and do everything we can to revoke their social license. They have no place at the UN COP meetings. They have no place there. Yet the most recent COP meeting that I attended, COP26 in Glasgow, there were more of them. There were more registered fossil fuel lobbyists than there were health professionals. So this is what we need to turn up the volume on our organizing efforts, because right now, there's an effort to try to get them barred from the UN COP meetings, but right now they are not only in the room, they are the loudest and most influential voices in the room. So this is our opportunity to become louder and more influential than the fossil fuel industry.
Ed, thank you very much again on behalf of ISBNPA. Can we have the ISBNPA standing ovation for Ed, please?
Thank you all. It's been such a pleasure to share these thoughts with you. Be well.
Thank you very much. As health researchers and professionals, please do engage with our group model building, because collectively we have a part to play for the common good, and we have to collectively find out what it is. I want to now welcome to the stage our host, Mary.